What's up guys, Tom here, and today let's talk about paracetamol poisoning. Paracetamol, or acetaminophen, depending on what country you live in, is one of the most common causes of fatal and non-fatal liver damage. And it's also one of the most common questions that people would call up a pharmacy late at night to ask about. Paracetamol is widely available in pharmacies and supermarkets around the world and is commonly used to treat things such as mild pains from a headache or body aches, as well as to help reduce fevers from colds and flus. It's also got some other uses such as an opioid sparing agent, but that's a bit too technical and for another video, but only if you like and subscribe with the notification bell on. Overdosing appears to be very frequent in people who don't seem to interpret the instructions clearly, so they follow their own set of instructions, or people who take 1 to 2 tablets and expect their pain to go away within an hour, and when it doesn't they take more, or in people who fail to recognise that paracetamol is actually available in a large number of different products that you can buy over the counter. Conversely, it's also a popular pill for people who are trying to end themselves, but if you watch the rest of this video you'll find out why it's actually a really terrible choice. So, how does it kill us? When paracetamol enters the body, the liver breaks it down into many different smaller molecules known as metabolites, each that will go and exert some sort of effect on the body, such as the ones I mentioned above. Majority of these metabolites are non-toxic, and if you're a science buff like me, they are broken down as a result of phase 2 metabolism using conjugation reactions, which involve sulfates and glycuronide. However, a small portion of paracetamol is metabolized by our liver's biggest enzyme system, which is known as the Cytochrome P450 system. Specifically, it requires 2 enzymes in this overarching system, and they are known as CYP2E1 and CYP3A4, which I'll refer to as 2E1 and 3A4 for short. When these 2 enzymes, 2E1 and 3A4, metabolize paracetamol, they produce a highly reactive metabolite known as N-acetyl P-benzoquinone imine, also known as NAPQI for short. Under normal conditions, such as taking the recommended dosages and not being intoxicated by other drugs such as alcohol, the body will very rapidly metabolize this and remove it before any damage occurs. In the case that we overdose on paracetamol, either by taking our doses every hour or every 2 hours, or taking 6 pills at once, the normal systems involving this sulfate and glycuronide are actually overwhelmed. So when this happens, the body will employ more of these 2E1 and 3A4 enzymes to come and take up some of the slack. And this is since our body really doesn't like all the random shit that we put in it, and it will see everything we ingest as either a toxin or food. So if it's a toxin, it'll try and get rid of it as quick as it can. As a result of more 2E1 and 3A4 being used, more of the NAPQI product is being produced and at a more rapid rate, so that it starts to accumulate. And because of this accumulation, there's actually a system which involves glutathione, which actually helps to react and pretty much make the NAPQI inert or unreactive. This system then becomes overwhelmed due to another rate limiting step, as well as depletion of the actual molecule glutathione. Therefore, we have more of this NAPQI in our system wandering around, eyeing off all of the liver cells that are looking back at it. So it does what any other small molecule with an inferiority complex would do, and it starts to randomly attack all of your liver cells and cause a huge amount of acute liver damage. So that's the mechanism in a nutshell. It does have a few other variables that can affect how someone responds to this, such as how much paracetamol they've taken, do they have any other drugs or things such as alcohol in their system, or their history with alcohol for that matter, and how much glutathione they naturally have present as an antioxidant in their liver. Now you're probably wondering, what the hell has your alcohol got to do with paracetamol and causing liver poisoning and death? Well, let me try and break it down simplistically for you. Ethanol, when it enters the body, is broken down into a highly toxic compound known as acetaldehyde, which causes a lot of damage to your body and is contributed to that drunk sensation you're feeling, essentially because it's quite toxic to the brain and it causes damage, as well as contributing to the hangover feelings that people get the next day. So naturally, your body wants to get rid of this unhealthy habit that you keep putting into it, and so it uses the little enzyme we spoke about before, CYP2E1. Now, in terms of how fast you get rid of the toxin, the standard rule that most guidelines follow is that if you have 1 standard drink per hour, that should be enough for your liver to be able to break down and get rid and remove all of the acetaldehyde that's formed. But generally, people tend to have a couple more drinks in that first hour, and then they have a couple more drinks after that, and in certain circumstances people like to just drink a lot of alcohol. So how does the body react to that? Well, your liver does this ingenious but very simple thing, and it just produces more of the 2E1 enzyme.
So it's a drinking.
Last one standing wins.
Well, no, because as much as that contributes to people building up a tolerance to their alcohol, it actually has a very detrimental effect when they take paracetamol. Because now, if you were to take paracetamol, you have a large pile of this 2E1 enzyme sitting in your liver ready to go, so that more and more of this enzyme system that otherwise wasn't used as much is now being employed because it's there and ready to go, resulting in more of the NAPQI toxic product being produced, which can lead to overwhelming that rate limiting step involving glutathione, which then results in the NAPQI sitting in your body for longer and then results in liver damage. Hence why a lot of doctors and medical professionals will recommend that anyone who's a known alcoholic should avoid paracetamol or take a reduced dose, simply because we don't actually know how their body will react based on the level of enzymes they have. So after all this, you're probably thinking, shit, I never want to take paracetamol again. And the good news is, if it's a small overdose, or even to some extent a large deliberate overdose, if it's caught within a couple of hours, usually with the treatments provided, there's minimal effect on the liver and minimal repercussions to the body. If it progresses beyond that time, say past 1 or 2 days, the liver will start to rapidly shut down due to all of the damage it's incurred, and eventually that'll continue to progress very painfully until the liver finally gives out and death occurs. Unless you're lucky enough to find someone who can transplant part of their liver to you so that you can actually survive. So on a final note, if you are taking paracetamol, or it is recommended to you, just remember to take it as prescribed by your doctor or your pharmacist or your medical professional. Just remember to let them know that if they have a YouTube channel, you'll like their video and subscribe. Until next time, I hope you enjoy your week. Do remember to follow me on Instagram as well. All the details are down in the description. I'll see you in the next one.